Our top story this evening, Singapore has confirmed its first case of the Wuhan virus. The patient is a 66-year-old Chinese national and resident of Wuhan. He's warded at Singapore General Hospital and in stable condition. The Health Ministry says that there is a second preliminary positive case, a 53-year-old woman, also a resident of Wuhan, and that's pending confirmation. And in a statement just in, the Education Ministry says all students and school staff must now declare if they are traveling overseas. Those who travel to China are advised to take their temperatures regularly for 2 weeks after returning. The ministry will take the necessary precautions for student trips and advise schools to postpone them if necessary. So let's speak to Professor Wang Linfa. He's director of the Emerging Infectious Diseases Programme at Duke-NUS Medical School here in Singapore. Professor Wang, thanks for joining us. The first imported case of Wuhan virus in Singapore, and then we might have a second case as well. What are the most immediate measures that needs to be done or stepped up to prevent any further spread of this virus?
I think it's a combination of from government. I think the government is already doing absolutely, the best we can. And the other thing is education to the public. Is I think I always say every citizen of our nation has a responsibility to really watch and see any people with unusual sickness, and they should go to the doctor. And also, the clinical side and the scientific side now is on full alert and ready to work together.
Professor Wang, the patient who's confirmed to have the virus, he stayed at a resort in Sentosa, and what we believe to be the case is that he stayed within the vicinity of that hotel. What steps should that hotel be taking right now?
I think the tracing of what we call close contacts. And so far, I think the transmission, what we think is contact-based transmission. So only the very close contact people have a risk of being infected. And I think, obviously in the hotel, they will be tracing all these close contact, and these people should be, either quarantine themselves or go to see a doctor advice.
Professor, the patient, we know, did not actually have clear symptoms when traveling here, and he only developed them after arrival. So the question is, how effective then is screening at border controls? Are you able to actually be very contagious without having a fever?
Yeah, so I have been commenting today, about what you can do is you do your best, because in this case, screening fever is the only thing really practical that every nation, every airport can do. But is that going to be 100% sufficient or effective? Obviously not, because it's very common for virus infection that the symptom develops after what we call incubation period. So unfortunately, during that incubation period, there's no way to detect.
Right. Chinese officials have also said that the virus may well mutate, that it is mutating, it is adapting, it could spread even further. What challenges is that going to pose in terms of containing this outbreak?
Again, it's what we call active surveillance. So, I'm a scientist working in this area, and Singapore is well prepared, and we learned the big lessons from the SARS. And I just watched it before you guys had a prime minister on it. And I think the SARS taught Singapore a big lesson, and we have been doing this ever since, Like the program I'm in charge of, Emerging Infectious Diseases Programme in Duke-NUS, was built in response to SARS, and I have been studying SARS for the last 16 years. So we're going to do very active surveillance in collaboration with every organization in Singapore. And within Singapore, we're very confident if we see any significant mutations, we'll be able to catch that and provide pre-warning to the citizens and the governments, and hopefully that we can contain this.
Professor Wang, you mentioned there, we know that you have been very active, with the research in SARS. So with the SARS and with today's Wuhan virus, what more do we know about this Wuhan virus? Because we're saying it's SARS-like.
Yeah, so I said 2 weeks ago, we have a SARS-like event caused by a SARS-like virus. So currently it's clearly that in the scientifically sort of a terminology, they're the same species, basically. But this new coronavirus looks like is less lethal and equal or more transmissible. So this is the dilemma we have. A virus, maybe kills less people, but most likely it will spread further than SARS.
Do we know how it actually came about? Do we know how this virus came about? There are various speculations that it came up from bats, it came up from snakes. With SARS, we know clearly it was from bats and then civet cats. Yeah,
so I actually discovered the origin of SARS in bats, so I can kind of safely predict. There's not 100% evidence yet. The virus most likely, like SARS, originated from bats. What we don't know is that civet equivalent. So for SARS, it's bats transmitted civets to human. For this virus, it's a bats transmitted virus, animal X, then to human. And the Chinese scientists on the ground is working very hard trying to identify what that animal X is.
Thank you so much, Professor Wang, for speaking to us. We've been speaking with Professor Wang Linfa, Director of the Emerging Infectious Diseases Programme at Duke-NUS Medical School here in Singapore. Well, China is taking unprecedented action to contain the outbreak of a new respiratory virus that's left 17 people dead and nearly 600 infected. It has locked down Wuhan, and that's the city at the epicenter of the crisis, and expanded travel restrictions to 2 nearby cities.
Now, the lockdown in Wuhan kicked in at 10 a.m. today, effectively isolating the city of 11 million. All transport links have been suspended and large public events cancelled.
Nearby Huanggang will soon face similar measures. Public bus and rail operations will be suspended from midnight, and people have been told not to leave the city, which has a population of more than 7 million. Cinemas and internet cafes will also be closed, and in Ezhou, train services have been suspended.
Chinese authorities have cut off transport links in and out of Wuhan. Bus, ferry and subway services inside the city are also halted until further notice. State media reported highway toll booths around Wuhan are also being shut. Residents have been urged not to leave the city and to stay home and avoid large crowds. Nearly 300 flights out of Wuhan's international airport have been cancelled. The travel ban has sparked a frenzy as residents and tourists alike try to beat the blockade.
因为他的姑娘也在这里，就是说回老家，还有老头老娘，因为他们那么大的年纪了，都等到儿子甚至回去团圆过年，也没得办法。
The illnesses from a newly identified coronavirus first appeared last month in Wuhan. A vast majority of the cases have been in the city. The World Health Organization says China is making a strong committed effort to curb the outbreak.
Based on the situation, taking the action that they think is appropriate is very important. We stress to them that by having a strong action, not only they will control the outbreak in their country, but they will also minimize the chances of this outbreak spreading internationally.
Trying to contain a city of 11 million people is new to science. It has not been tried before as a public health measure. So we cannot at this stage say it will or it will not work.
The unprecedented lockdown in Wuhan comes as millions of people are traveling across the country for the Chinese New Year holiday.
And Vietnam is the latest country to confirm cases of the coronavirus. Both are Chinese nationals, a man who came from Wuhan and infected his son living in Ho Chi Minh City.